Jill, welcome to Cherokee Now. Today we have Vickie Bradley with us. Vickie is the Secretary of Public Health and Human Services here with the tribe. Vickie, welcome to the show, and thanks for taking a moment to come on and share some updates on a new exciting project that you and your team have been working on. Tell me a little bit about Solagee Public Health.
Solagee Public Health is a brand new program, sort of. It's a rename of the Cherokee Women's Wellness Program. It is a dedicated public health team. Now, we are not losing the clinical services or the women's services of the program.
Okay, that's good.
We are just enhancing and adding to services to create a team that does evidence-based prevention curriculums in the community, and it would be much like a county health department.
I got you. Okay, and one of the programs that we're going to talk about today specifically is the harm reduction program. Tell me a little bit about what harm reduction is.
Well, harm reduction, we talk a lot, can cover a lot of topics. Specifically for this one, we're going to talk about syringe exchange program. I have some notes, Chris, I'm going to refer to, so I don't want the public to think I'm just reading, but I don't want to miss some things or my team will just not be happy with me.
This is very important information. It's something that we want to stay ahead of and make sure that the folks out there in the public that have any questions or concerns about what we're talking about have all the information. So thanks for doing that for us. What is syringe exchange?
Well, let's talk harm reduction first. Harm reduction is meeting people where they are.
Okay.
It is not trying to change behaviors or pass judgments on what they do, but teach them how to do what they do in a way that reduces the prevalence of disease in the community and reduces the harm to themselves and their body.
I got you.
Promotes health and well-being.
Awesome. Okay, and is that ties in, therefore, the syringe exchange ties into the harm reduction, so a component of that?
It is. Syringe exchange is one of the programs that harm reduction is most known for. Syringe exchange is basically distributing syringes and needles and the equipment that it takes to inject drugs in a non-harmful way.
Okay.
And that is the new program that we will be implementing under ordinance,
right,
and directed by tribal leadership.
Now, when did that become a law? How did that come to be?
Well, North Carolina passed the law in July of 2016 through House Bill 972.
Okay.
And on the tails of that, the tribe passed resolution, and then subsequent to that, Ordinance 621 on August the 8th, 2017.
Okay, and that made it legal. Now, are there other places that are doing this?
There are about 25 programs in North Carolina, but they are done all over the world.
Okay. Why do we need a syringe exchange program here in Cherokee? Why is it important?
Well, I don't think there's a family in our community, Chris, that hasn't been affected by overdose, that hasn't been affected by those that use intravenous drugs to see them have infections and a lot of different problems. And so accidental overdose deaths from the use of prescription opioids, and I'm looking at my notes here.
You're fine.
In 2015, for the first time in U.S. history, the number of heroin-related deaths outnumbered gun homicides.
Oh, my goodness.
That's incredible, isn't it?
That is.
In North Carolina, 25% of the 1,567 overdose deaths involved heroin. Now, we know that in Cherokee alone, in the last year, I think all of us can say that we've had families that have been touched by drug overdoses. And so prescription opioid pain medications are responsible for more deaths in this country. And North Carolina has also had a high burden of fentanyl-related overdoses. Okay, so if current trends continue, unintentional drug and medication overdoses will surpass motor vehicle accident deaths in 2017.
That's something we've got to get ahead of. That's terrible news. It's something that's affecting everybody, and so we feel like this is a step in the right direction to potentially reduce the harm caused by the side effects of addiction and the things that are coming in this area.
Absolutely. And more than that, we have a lot of conversation about hepatitis C in this community. We've had about 668 positive cases of Hep C. We have right now about 385 infectious.
Okay. And Hep C is one of the things that are passed on through
absolutely
intravenous.
Bloodborne. HIV infection, hepatitis C infection, all those are transmitted specifically through blood with the use of intravenous drug use.
Okay. And that's here and it's in our community.
Right.
Okay.
So let's talk about syringe exchange.
Okay.
Syringe exchange is one of the most effective public health interventions to reduce the incidence of disease in the world.
Okay.
It is effective by expanding access to clean syringes and needles, we can reduce the incidence of disease, we can reduce the amount of biohazard materials on the streets and dirty needles on the streets.
Absolutely.
And so we know, looking at my numbers again, there is a 66% reduction in needle sticks to emergency medical workers and police when syringe exchange programs are available in the community.
So this is going to make everybody feel a little safer, potentially.
I think so, because the idea is you bring in your dirty needles,
Yep.
you exchange for clean. But more importantly, those folks who participate in a syringe exchange program are 5 times more likely to enter treatment than those that don't.
That's an amazing statistic. Now, speaking to the folks that are coming in, what legal protections do you have for employees, volunteers, participants of the syringe exchange programs? Are there legal protections for them?
Yes. So the North Carolina law and the tribal law protects employees, volunteers, participants in the program that have, actually, let me just read this to you.
Okay.
To encourage people to feel comfortable using the exchange and to avoid any uncertainty should participants be stopped by law enforcement. Exchange should offer participants a wallet card or other documentation that they are a participant in the exchange. These folks can show this card to the police, and if they have possession of syringes or other injection supplies with residual amounts, they are not arrested. That does not mean that they can carry drugs. That does not mean that they can carry syringes full of drugs.
Okay.
It just means if they have residual or those supplies on them and they show their card, then it is a non-criminal act.
I got you. So there are protections for folks that are using these services. What services are syringe exchange programs required to provide to the participants?
Well, we have to distribute the supplies that go with injectable drug use.
Okay.
So that would be needles, syringes, what we would call cookers, tourniquets, alcohol, triple antibiotic, anything that would protect that person from getting an infection. We have to give education materials on HIV,
Okay.
hepatitis C, pregnancy, overdose prevention. We have to have access to treatment referrals, substance abuse counselors, and we also have to have referrals for naloxone,
Okay.
or the drug that helps folks who have overdosed.
To avoid the overdose from leading to death.
Right.
So you do, what we are saying is that when folks come in and participate in a needle exchange, they will get a package that may contain educational materials to help them with their addiction, should they want that?
Absolutely.
Okay.
Absolutely. And we will have medical professionals, we will have nurses, we will have access to substance abuse counselors, and all of that team, of course, will accept people where they are. And when they are ready, and we will assume they will eventually be ready
Right.
for treatment, they will offer those referrals to them. It's also a great way if the team recognizes that maybe they are having an infection, or
Okay.
we do HIV counseling, we do hepatitis C testing. That's required of the program as well, so that if individuals that come in are positive, then they can get proper medical treatment and referrals necessary.
Okay. So
reduce
it's
the
a
disease.
little bit more than just coming in and exchanging some of my used needles, and I'm getting new ones. There's a little bit more to it that we're going to be able to touch them with and reach out and offer should they need it or want it.
Absolutely.
Okay.
An ideal syringe exchange program is not just exchanging needles.
Okay.
You could do that, but that's not our intent.
Okay.
We really want that harm reduction concept.
Right.
And harm reduction does anything that we can to reduce harm to that individual and their family.
And again, you stated earlier, there's, what'd you say, a 5 times more likely chance for them to enter
To
treatment?
enter into treatment, yes.
Coming through a program.
This state and the country spends a lot of money on hepatitis C.
That's right.
One person that has hepatitis C, it costs about $100,000 to treat them. And so you can imagine if we have over 300 individuals in our community,
Do the math.
we're going to treat, but we want to stop that spread of disease.
That's right.
And so with harm reduction, what we want to do is build rapport with that individual
Right.
and instill hope that there's a different life there.
Yes.
But when you're ready, we will offer those services.
Yeah.
I think that's the difference in harm reduction is We are not trying to force change upon you. We're just giving you the information to help you
We'll be
make
an
those
outlet
decisions.
to provide a safer environment for all people,
all people.
not just the folks that need this program, but the folks in the community that are. I've seen a number of reports on Facebook. We're finding needles in playgrounds. We're finding needles in public restrooms. Our sanitation crews are finding them in very bad places.
Absolutely.
And it's dangerous to the public, and it's dangerous to everyone. And I can't imagine a child getting stuck with one that's an infection, and getting infected with something. So hopefully this will help to we never have to have that story come out. We can prevent that and get everybody feeling a little bit better and a little bit safer, and hopefully stopping the spread, like you're saying.
Right. In communities that syringe exchange programs exist, the incidence of dirty needles on the street goes down significantly.
Oh, good.
And so we will have disposal sites at the facility, and the intent is for people to bring in their dirties. We dispose of them properly.
Okay.
And if there's not a stigma with bringing them in and properly disposing, then hopefully they will not be flipping them out the car window or putting them in regular trash cans or
Right.
doing whatever they do.
Right.
It will be much easier for them to dispose the needles.
That'll be great. Now, is there a restriction on how many syringes we can hand out per person?
There is not. North Carolina has a law that says you can't do one for one, that the program has to be able to give what that individual needs.
Okay.
Now, we will not be doing a peer-to-peer exchange. What that means basically is if you are using the program, you can't come in and say, I need needles for my 10 friends.
Gotcha.
We will encourage you to have them come in individually so that they get the education and they get the benefit of using the program.
I got you.
But a syringe exchange program has to give what is
Needed
for that
user.
person to inject clean.
And so in that same light, do they need to bring in used needles to exchange for new ones, or is that?
They will initially
Okay.
be encouraged to bring a certain. They will. Yes.
Yes.
In a nutshell, yes. They will need to bring needles back
Okay.
in order to get needles.
What do we estimate maybe a time frame for seeing a facility like this established?
Well, we're excited. The tribe has appropriated money, and we have that as a set aside. So right now, we're going through internal processes to get positions comped. We have position descriptions written. This will be a team of 5 people that works
Yeah.
this program. And then we hope to open the doors sometime the first quarter of 2018.
Well, that's a quick move. That's
It
good.
is.
That's
It's gonna
coming
be
up very
quick.
soon.
Our teams have been working very hard. Hats off to the public health teams at PHHS. The Sologee public health teams have been working
Yes.
diligently on this, developing policies, procedures, visiting other programs, learning what is best practice and industry standard, learning how to do this in the most effective way,
Right.
and of course the most cost-efficient way. But we want a program that is exemplary,
Right.
not only in North Carolina, but in Indian country.
Right.
And we want our people to trust our program. We want to get the needles off the streets, but more importantly, we want to be able to reduce the incidence of harm and disease in our community.
And this is prevalent across the country, across the world.
Yes.
What's great about us being here in our little sandbox in Cherokee is that we can explore, being a sovereign nation, and we can explore ways and treatments, and you can connect, these programs can connect with others, such as the Mothertown Project. We can start to work hand in hand and get some real help and maybe attack this issue head on to where we can start making some real changes in what we're seeing around us here. Will this only be a service to EBCI enrolled members, or will it?
No, this program is one of those programs, in order to be effective, we can't limit it to
Okay.
EBCI enrolled members. We will primarily serve our community members, but as you know, people have partners, they have friends that they use with.
Right.
And so we will serve those who are using in
Yeah.
our community, whether they are enrolled members or not.
And that's great. That's great. We open
Yeah.
our arms to everybody here. That this is an issue that everybody's dealing with, as you mentioned when we started. If you hadn't been affected by it, God bless you, because this is touching everybody.
It is.
I hope you continue to get the support that you need. I know that Chief Sneed's been a really big supporter of this. He's encouraged me to take a look at this on the inside and see what I see as well, and to help get this media out to the public. That's what we want to be here for, is to help make sure that this information gets out, and that if any questions are out there, that we get them the right answers, and that folks are aware of what we're doing. So if there's anything else that you have, let's chat about it.
Well, our Salagie Public Health team has been going to some community clubs.
Oh,
we
good.
will begin to disseminate information in the community about the dates, place that we will be open, and all of that as we get closer to the move. But we will also entertain questions
Absolutely.
that communities have. So if you would like for our group to come out and talk to your teams, your churches, your communities, anything like that, we'll be glad to do that.
Okay.
We have a lot of information. We're learning as
Yes.
we go. We are only one of 5 tribes in the nation to have their own syringe exchange program. And so we're talking to those other communities that have had them.
Right.
Some have had them for 20 years.
Really?
It is the only proven methodology that reduces the rates of hepatitis C in the world. And so we are all about our people getting healthy and making healthy choices. And
Good.
so we hope that this program will reduce the incidence of
Good.
disease in our community.
What is a way that someone could contact someone on this team or in your office? Or
You can call our main line, which is the public health receptionist. Ms. JoJo Teske will direct you to
Okay.
a team that can give you assistance, and that number is 828-359-6180.
Okay.
And we'll be glad they can talk to me, they can talk to Emma Waldroup, who is the manager of Salagie Public Health, and we will help all that we can.
Get all the information out there that we can.
We're just so excited about
I am
this.
too. This is good for the
It's an
community.
emotional issue.
It is.
It's it's a kind of a paradigm shift in the
Yeah.
way we think, because it's like a lot of people have said, why would we give syringes and encourage people to use? But that's not what we're doing.
Right.
We are trying to create a healthier community by, once again, I've said this 100 times, I'm not going to say it, reduce the burden of disease on our population.
Right.
And so we hope to do that through
Well,
this
good.
program.
Well, thanks for joining us, Vickie, and I hope to see you again anytime that we get updates on this, or when you have any other programs we wanted to talk about. Please join us on here and help us get this message out to the public.
Thank you. Thank you for having me.
Absolutely. Well, that'll be it for today. If you're listening at home and would like to comment on the show or ask questions regarding what we've discussed today, please comment on our EBCI Cherokee Now Facebook page at facebook.com/Cherokee Now. We look forward to seeing you again soon. Data Dagahungi.